Is it because I'm not pretty enough? Is that why he couldn't get up when he sees me?
Whoa, things just got real. Yeah, I don't... Hey guys, Dr. Gary here. So today I'm gonna do a reaction video to a BuzzFeed video that's called I Got Plastic Surgery and I Regret It. I've never watched this. Someone told us that we should maybe react to it and we said sure. So it looks like someone by the name of Sherry had plastic surgery and she never imagined the impact that the choice made on her family and future. Okay, let's take a look.
My name is Sherry Tung. I once got plastic surgery and I totally regret it. And this is that story. This all started in my freshman year when I was in college. Growing up in Shanghai, spending my teenage years there, I always thought I was not good looking enough, and I still remember when I was just a couple years old, my own grandma actually called me ugly. She said I'm the ugliest cousin out of all 3 female cousins.
Ouch. Yeah, I mean, I think a lot of this stuff in terms of like self-image, insecurity starts really early for people.
I need to tell you that you're just a little ugly.
And I think a lot of it, because it's starting, early, and as we're being formed in our thinking, in our just overall maturity, I think a lot of it is starting at home. So I can tell you, as my wife and I are raising our 2-year-old, we're always just telling her how beautiful she looks and how cute she is, and no matter what she actually looks like or whatever, but we're trying to instill those thoughts of positivity, because no matter how someone actually looks, you can feel really good about yourself, and that's a powerful thing, I think, to go through life with. And you can also, on the flip side of that, be the most beautiful person in the world and think that you're ugly, and I think a lot of it stems from how you're brought up.
The beauty standards in China is just pretty harsh. You have to be a size 00, you have to wear XSS in clothes, and you have to basically look like a Barbie doll, or you'll be considered ugly.
Yeah, not everyone fits the standard of, the mold of how, we're told, beauty should be in society. And that's okay. That's totally okay. It's just about, I think, accepting your appearance, and that's actually really hard to do. And that's why people come to me asking for different changes, whether, their face has changed with time, just with the aging process, or there's a specific feature. They might be a younger person, but they may just really dislike something about, a facial plastic surgeon, so about their face. But I think it's always best if you just are so confident and comfortable in your shoes that you don't need any surgery or anything like that. I mean, that's just not reality, but yeah, in a perfect world, people would be confident about everything, about all decisions. They'd never be insecure or worry about anything. There's a lot of things that we could surmise in a perfect world, but we're only humans, so we're not perfect.
But in a relationship, and it was all rainbows and butterflies. I felt like I was finally being loved unconditionally, being loved for who I am, until I realized that I had difficulty having sex with my boyfriend. We tried a couple times, and I started thinking that, is it because I'm not pretty enough? Is that why he couldn't get up when he sees me?
Whoa, things just got real. Yeah, I don't really have a whole lot of commentary on that. You would hope that if somebody is with you, that you're dating somebody, that they hopefully find you attractive. And then there are other, of course, reasons for someone to have difficulty, getting an erection. That's not my area of expertise. I don't know. It could be that, but it could be also, maybe it was his problems, and not hers. But again, with the insecurity that she had, she made it her problem. She put it on herself and started to blame herself, when in reality, maybe it was his problem the whole time. But again, that's the power of self-confidence, and that just doesn't happen, from thin air. You're brought up with it, ideally, and it's something that is continued to be supported throughout your life. So yeah, so it seems like, she didn't have that, and so she was blaming herself, and maybe, she shouldn't have been.
And every single time I try, it's not even about the sex anymore. It's more about, can I make him want me again? Can I make him feel attracted to me again? And This summer of my freshman year, I decided to go get plastic surgery.
So I tell people this all the time, you know, do plastic surgery if you want for yourself. Don't do it for a significant other. Don't do it for, you know, a spouse or someone at work that you're trying to impress. Truly do it for yourself, because there's something that you see that you would like improved, regardless of what anyone else thinks. I mean, that is always the best strategy. And we had a video where I talked with a psychiatrist about people's desire for plastic surgery and, you know, kind of a healthy approach to that. And that's also what he said during that video.
To have this surgery done so this person thinks I'm more attractive, or it's going to help the relationship, or, you know, it's going to make my life much better, then it's kind of, you know, more of a red flag for me. Okay, let's take a pause. Let's try to work on this. Let's try to figure out really what's going on and process it without needing to run to get a surgery, which likely will not fix that problem.
That is super important. So clearly her reasons for doing the surgery, I think, were not ideal.
I'd always had some insecurities around my nose, and I always felt like my side profile doesn't look good enough. And so I added this WeChat person. WeChat is kind of like Messenger here. And so initially I was just, you know, looking at the pictures, scrolling to find like beauty inspiration. And then I saw this WeChat person is representing a hospital. I saw the before and after pictures, and the changes were just so drastic.
So the pictures she just flashed there on the screen, for example, they look like heavily, you know, computer generated. This just doesn't look to me like it's a natural kind of result in a natural photograph. Heavily photoshopped, really just almost doesn't even look real. I mean, so like everything has changed. It's not just the lower jaw, it's the entire width of the cranium, which there's no surgery for that. Changing the entire width and making everything more narrow. There's lower jaw surgery and some mid-face work that can be done to kind of slim out the face, but you can't make all of this just more narrow, right? Because there's a brain in there. So this to me looks very artificial, and if this is what they're using to try to sell surgery to people, that's upsetting, you know, because this really just doesn't look real.
So drastic. And so that made me feel like, wow, this is almost like a kind of like get rich quick, but like get pretty quick procedure. And so, yeah, I just remember following that account for a while and finally deciding to bite the bullet when it's summertime and I go back to Shanghai. So my family did not know, and of course I sneaked out that day. I just told my parents, hey, I'm just seeing a friend. It was definitely one of the scariest things I've ever done in my life, and looking back, I'm just so glad that I didn't die, because honestly, I don't think that hospital is even legit.
Whoa. Yeah, that's not good. I mean, anytime you go for surgery, you have to check that the hospital is fully credentialed and accredited, that your doctors are sort of the real deal, board certified, all of that. I mean, that's super important, right? Because number one is always patient safety. So the fact that she wasn't secure in that is worrying. And again, I guess she was trying to keep it a secret from her family, and maybe that's why, you know, she didn't want to go maybe to the more well-established places and fear that they would find out. I don't know. You can't compromise on that. Always a safety number one. And then secondarily would be like the kind of aesthetic results that you get.
I just remember going there and they didn't even test my blood. They didn't do anything. And the same day I checked in, that was the day I had my procedures. The procedure that I got done is rhinoplastic surgery. They take an implant. It doesn't like hurt that much during the procedure because you're numbed, but afterwards you do feel quite a lot of pain over here. The toughest thing is to breathe.
So it looks like she had a rhinoplasty, and that implant that they showed looked to me like a type of silicone, like an artificial type of implant, and that's still used to this day for basically building up the nose, especially the dorsum. In Asian rhinoplasty, oftentimes there's a flat kind of aspect to the bridge of the nose, and a lot of people will want to build that out to get more projection. The bones in Asian people, and also African Americans as well, the nose, the bones are very flat and short, so you can't really break them to reestablish that bridge and create more projection. So instead of that, you basically have to add to the bridge to get it to come out and for the nose to look smaller or more narrow. So it's a bit of a different strategy than like a Caucasian nose, where you can actually re-break the bones and recreate your pyramid. Kind of a technical point. I have a plan for like a big series on rhinoplasty, so a lot more coming on that. But in this situation, it does look like she had a rhinoplasty, probably with one of these types of artificial materials, and it's typically placed through a little small incision at the base of the nose, and then you slide that graft in there once the nose is opened up. Here you can see her at 253 with some tape along the dorsum of the nose, and that's usually to kind of keep the area from getting too swollen and kind of just keep everything together while it heals. And then this is called a drip pad dressing, and you can see it already kind of saturated, just collecting some of the blood that's coming out of the nose. So this looks like maybe she just had surgery that day.
And it makes my mouth really, really dry. And I'm not a mouth breather, so I'm not used to it. I don't know why I was like so naive. I thought I could just like go home and hide in my room and no one would see me during the recovery period, which is like 10 to 15 days, which is like not short. Like, why would I think that my family wouldn't know? I just remember wearing a mask and a cap and just going back home normally. Of course, my dad, I think he first noticed and he was like, "What's up with your face? Like, why do you have bruises?" I mean, I couldn't explain it. I can't say I got beaten up.
Yeah, recovery from rhinoplasty the initial recovery does take about 2 weeks. Similar to most facial plastic surgeries or any kind of facial surgery, the initial period is about 2 weeks for bruising and most of the swelling to start to come down. So that's a pretty typical type of recovery from what she's describing.
And so I just told my dad, I got my nose done. And he was so angry. I've never seen him so angry. And I think part of it is because he thinks that by me getting work done, I don't look like him anymore. He thought that I was, not grateful.
That's interesting. I mean, a lot of times parents and families don't want their child to get surgery or their family member to get surgery because they don't think they need it, right? They think like, okay, well, they're beautiful the way they are. But I guess another explanation could be what Sherry's saying, that the dad actually thought that she then looked less like him or less like the family and was being disrespectful, which is kind of a different way of looking at it. But yeah, I mean, I guess that's a real possibility too.
Of what he has given me, which is like, I guess, my face. At that time, I just felt like all sorts of emotions coming towards me all at the same time. The plastic surgery itself also came with its complications. The implant that I got in my nose started kind of poking out a little bit, so you can kind of see.
Yeah, one of the risks of these artificial types of implants is extrusion, meaning that the implant, basically the body tries to kind of kick it out, right? Because it's recognizing it as foreign. So either it just surrounds it with a capsule and just kind of keeps it there, or the implant can actually start to extrude out and it can get infected in the process. And then when that happens, you essentially almost 100% of the time have to remove the implant and treat with antibiotics, and sometimes the ultimate result can look worse than before you even started. And because of these implants having these potential risks, what I prefer to use just on the surgical side of things is actual cartilage, whether it's from the individual or cadaveric cartilage, to have a bit more of a natural type of graft that's less likely to be infected, rather than these kind of artificial pieces that are kind of easy, just slip it in there. But they can have these complications not just in the early post-operative period, but also like years later. So you might live with a nose that's operated that looks okay, then 10 years later that piece of silicone can get infected.
The shape of the implant, and under the sun, my nose was like red and transparent, and that again triggered another series of insecurities. I felt like, oh my gosh, people are gonna know I got plastic surgery. They're gonna know that, even if they consider me as pretty, that'd be fake and I'd be an imposter.
Yeah, that's definitely one of the sentiments that people worry about, that possibly after plastic surgery that it's almost like you're not your real authentic self and that others are going to kind of judge you for it.
Wait a minute. Who are you?
It's an honest kind of fear that people have. Most of the time it's not completely true, in that a lot of times if the surgery is done well and naturally, a lot of times people have no idea that you had surgery. And then nowadays I think it's becoming more of an accepted thing around the world, so most people don't really judge you for it. But of course there are different circles, especially different generations that look at it very differently. But I understand what she's talking about, kind of feeling like an imposter, that you're this sort of fake person because you had surgery. I get where she's coming from with that.
Having a strange substance in my body, and I have no idea how my body's gonna react to it like years from now. And that fear really kept me up at night, reading articles after articles about how to deal with your nose implant that has signs of poking out. And in the end, I decided to take it out. And now my nose doesn't have any implant anymore, but it's still not the same as before because there are scarring tissues.
And that's exactly what I was saying. Like, she had it removed and now she's kind of worse off than if she did nothing. And that's upsetting, right? Because she went through all of this kind of turmoil, and now I see why she regrets having had it done in the first place. I tell people this, it's not just about the act of doing a surgery. It's like the planning of everything that's the most important. Most of the time should be spent during consultation, really planning things out, and the day of surgery, really making sure the person understands what they've gotten themselves into and what the overall kind of strategy is. If that is solid, then everything else sort of follows. If there's no great strategy and it's just like, oh yeah, let's just put in an implant, not think about its potential consequences or the final appearance or how you'll ultimately think about yourself, then that's not a great way to approach it.
My nose still feels like harder than before, but at least there's no implant inside.
That is the scar tissue that she experienced.
At least I can not worry about stuff poking out of my nose. And it really took me so many years, I would say at least 5 years after that initial incident with my boyfriend at the time, that made me realize that it's probably not my face, it's probably not my nose, it's something else. Like, it's not about me, it's not about the way I look.
See, exactly, like she came to that, but unfortunately had to go through an unnecessary plastic surgery. But she ultimately realized, it seems, that all those instances with her boyfriend was probably more about him than it was about her.
It was you!
It took me a long time to finally accept that the way I am, the way I'm born, it's all right. Since I also make personal finance YouTube videos, sometimes I would like look at my face and be, oh my gosh, what is this double chin doing? Even though it's like a personal finance channel, like who cares about my double chin? That's still something that I'm working on, but overall, I don't feel as insecure about my face anymore. Try not to give yourself too hard of a time.
Yeah, like I get what she's talking about here, because, you know, I make my videos and I try to kind of keep them on specific topics, but then a lot of the comments that I get are like about the way that I look, you know, and people commenting on my voice, on my hair, on my nose, on my eyes. You just have to kind of be ready for it when you go out there and just put content out. So it seems like she's still coping with it. I definitely more recently have, you know, come to terms with some of that, but there are still some comments I get that, you know, can be hurtful. But when it's really bad, I just delete the person from my entire channel, block them, because if they're writing stuff like that, first of all, they're not really experiencing the content for what it is and really trying to like learn something from the channel, which I think is the goal. They're really just kind of out to just be mean and disruptive. We don't tolerate that.
Don't forget to practice self-love because you deserve it.
Yeah, great video. Kudos to Sherry for sharing her story. I mean, it's really hard to come out with that, and I guess BuzzFeed too for putting that out. That's awesome. Really enjoyed listening to her. I mean, her like journey towards self-acceptance is phenomenal. You know, I think she's there now, and that's awesome. It takes people sometimes a really long time to get there. You know, sometimes surgery can actually help you get there, believe it or not, and other times it can be a hindrance. And so again, a lot of it is proper planning and proper understanding of people's mentality for what they're doing and why they want changes to their bodies. So hopefully you guys found that interesting. I definitely enjoyed watching this video. If you did, just make sure to, you know, do the usual, like, comment, subscribe to the channel. And there's definitely a lot more to come on, you know, plastic surgery specifically as it relates to the face, and hair restoration. That's what I do. See you guys.